Hi, Dr. Henry. I wanted to ask about when we're looking at the proportion of cases that are explained or linked to clusters here in British Columbia. That's something that we hear you reporting on quite a lot, and we know that that it's a pretty high proportion here in British Columbia that we're able to trace back to a cluster, even if it's a new cluster, as we heard about today. I'm wondering if you can help explain to us and to readers the degree to which that number, that ratio that is, connected to, of cases that are connected to clusters, the degree to which that number is related to the level of restrictions that we have in place here in British Columbia, the fact that we still have many businesses that are open compared to hotspots that we see in Ontario and in Quebec, or whether there are other factors that are really significant in determining the level of restrictions here, more significant than that one that I just described.
Yeah, so I've said this many times over the last few months. The unlinked cases are the ones that cause us most concern. And we know from this virus, we've learned a lot over the last 10 months. We know that most people transmit to none or one person. Some people will transmit to a large number of people. So, and we don't always know why. Those super spreader events sometimes, or they're what we call random events or stochastic events in some places. But we know there are conditions that make those types of spreading more likely. And those conditions are, we've heard them referred to as the 4 C's. So in a closed environment where close contact with crowds, large numbers of people, where there's poor ventilation. And we've seen that. We've seen that in workplaces. We've seen that in nightclubs, for example, where we had spread between larger numbers of people, and it made our work in contact tracing very difficult because you didn't always know those people, and we would find that it was a challenge to understand exactly who was in that nightclub at that period of time and who you might have come in contact with, and then to connect with them. So it makes our job in contact tracing much more difficult compared to a restaurant where you might have a small number of people. We put the limit at 6 at a table where you have a contact number, so the risk is much more controlled and managed. So what we have tried to do in British Columbia and been successful at, because people have taken this to heart, is only put in PHO orders to try and reduce those areas where we know these things are happening, where we know transmission has been happening. So we've put in very few orders, some around times for restaurants, because what was happening was we were seeing that late at night people were going there to drink, and it became more like that nightclub environment. We've had to put some orders around banquet halls because we knew that it was very challenging, and we were seeing very challenging for them to manage the 50-person limit, and families wanted to be together or wanted to have celebrations with larger numbers of people, and that was leading to transmission to large numbers of people. So our focus has always been on trying to reduce those environments where it's more likely that somebody is going to spread to larger numbers of people. And that's why we've consistently stayed at 50 for any gathering, plus with the provisions that particularly if you're inside, you need to have sufficient space between people that you're not going to put them at risk. And we need to use our other measures like hand cleaning and wearing masks. So what we have seen is that when those provisions are in place, we don't see transmission of this virus to large numbers of people, and that has meant we've not had to close down additional businesses and other things. Other provinces have taken different measures, and we're all trying to muddle through this together, learning as much as we can from what we see around the world. So we have tried to minimize and take restrictions, and we've put in another order that requires every business to have a plan. And I think that is an important way of us reinforcing that every single business needs to look at their individual situation. And the guidance that we've put out through the BC CDC and WorkSafe BC helps every different sector. And as I've said many times, I don't know the ins and outs of every single sector. So if we connected with every different part of industries to be able to put those things together. And that has been successful for us. If we think about this past summer, we planted over 300 million trees in the north in BC. And those are incredibly important to our climate and our ecosystem. And we did it with thousands of workers going up into the remote areas and not a single case of COVID. So we know, for example, when we have temporary farm workers and we support them to isolate for 14 days, we're not getting outbreaks on farms. So this is the approach that we will continue to take as we're moving into this respiratory season, finding the balance and making sure that we take action if we need to try and reduce areas where we're seeing transmission happening.
Alex, do you have a follow-up?
Yes, just a quick one. That's really helpful. Thank you, Dr. Henry. So when you're describing how most people who are infected with COVID-19, they're transmitting to either nobody else or one person, the new cases that we're seeing in BC, are a lot of them those, one close contacts who are connected to somebody who is already sick, or are more of the cases connected to those rarer super spreader, whatever the correct name would be for those events where more people are getting it at one time?
Yeah, it is a combination, but we are mostly seeing small transmission chains within a family, within a group, and because we're not allowing those groups to be very large, the transmission stops, or it only spreads to a few people. We are seeing many small clusters, and then we have a number of larger clusters, primarily like one we saw today in a number of workplaces, essential workplaces, where people are in close contact, and there may be breaches in the protective barriers that we have in place. So it is a combination. We were seeing quite a lot more large spreader events when we had nightclubs open, when there were large parties through the summer, but mostly those have settled down or become much smaller and more easy for us to contain. When we find people, we can isolate people before they develop symptoms, before they spread on to that next group of people, and that's how we have been pretty successful about breaking the chains in our community. And we need to keep up with that, because it's when you start getting a lot of spread in the community that you can't keep up with the contact tracing, with the numbers of chains of transmission, that you have to refocus and shut down, take more blunt instruments in trying to prevent occasions for spread to happen. And we're seeing that in some other countries and some other jurisdictions. I will say the one other factor that's in there in terms of biology is that some people seem to spread more virus than others. And we can't tell ahead of time who it is or why some people seem to be more able to spread the virus than others.